Okay, so today we're diving into something pretty intense, all right. We're talking about those moments, those really critical situations where someone can't breathe and traditional methods just aren't an option. Emergency surgical airways.
Yeah, high stakes for sure. We're talking about giving someone the best possible chance of survival, and sometimes that means making a split-second decision to, well, create an airway
And
surgery.
that's what this document you sent over is all about, right? Cricothyroidotomy and tracheostomy.
It is.
And it seems like cricothyroidotomy is kind of the go-to in most of these cases. Is that right?
You got it. It's quicker, often safer, especially when every second counts.
I can imagine. So instead of like the traditional intubation going through the mouth,
Right.
they make an opening where?
So with a cricothyroidotomy, you're going through the cricothyroid membrane. You know that little dip you can feel right below your Adam's apple?
Yeah, I think so.
That's the spot. It gives a more direct route to the trachea, which is, of course, the main airway.
Okay, so instead of trying to go for the trachea directly, it's like a shortcut.
Kind of, yeah. But you have to know what you're doing. Precision is key. The document really emphasizes that.
Oh, I bet. The stakes are pretty high. And I noticed it mentioned two different types. Needle cricothyroidotomy and surgical cricothyroidotomy. What's the difference?
So think of needle cricothyroidotomy as a quick fix. You use a large needle to puncture the cricothyroid membrane, get some oxygen flowing. It's temporary, just to buy time.
Okay, a stopgap.
Exactly. Surgical cricothyroidotomy, that's a little more involved. Incision, breathing tube inserted directly into the trachea. A more stable solution.
Two different approaches, same goal, getting air into the lungs. Now, this document goes into a lot of detail about the surgical approach, specifically something called the rapid five-step technique. What's that all about?
Yeah, the name says it all.
Yeah.
Rapid, it's all about speed and efficiency in this situation, right? Precise incision, then they use a special hook, a tracheal hook, to lift the trachea so they can get that breathing tube in.
Looking at this diagram, it seems like that area, that membrane, it's pretty close to some vital structures.
You're not wrong to be concerned. One wrong move.
And
Well, you can imagine. Blood vessels, vocal cords, even the trachea itself could be damaged. So knowing the landmarks, that's crucial.
it's like, what's the phrase, walking a tightrope?
Yeah, it takes a lot of training, a lot of expertise. You have to know the anatomy inside and out.
Yeah.
And even then, things can go wrong.
Makes the needle cricothyroidotomy sound, I don't know, almost easy in comparison, even though it's still obviously serious, since it's quicker. How does that actually work?
Well, like I said, you're puncturing the membrane.
Yeah.
But this time, instead of an incision, they use a cannula, a large bore cannula, basically a tube.
Uh-huh.
And that goes directly through the cricothyroid membrane and into the trachea.
Directly in.
Yeah. Then they use a syringe, make sure they're in the right place, pull back, get air, and they know they're good. Gives them that direct route to get oxygen to the lungs. But it's only a temporary solution. The document mentions it can only sustain oxygenation for about 30-40 minutes, tops.
So really, it's just buying time.
Exactly. Until they can get a surgical airway established, whether it's through the surgical cricothyroidotomy or, well, there are other options.
Right, like a tracheostomy. The other big one we need to talk about.
Exactly.
And it seems like that's usually the choice when a cricothyroidotomy just isn't possible.
Right. Think about severe facial trauma. Imagine the anatomy all messed up. It can make cricothyroidotomy really difficult.
Oh, I can only imagine.
Or if there's an obstruction higher up in the airway, that's another situation where tracheostomy might be the better or really the only option.
And I noticed the document also mentioned pediatric patients, kids, as a situation where a tracheostomy might be preferred. What is it about their anatomy that makes cricothyroidotomy riskier?
Well, imagine trying to do any of these procedures on an airway the size of your pinky finger.
Oh, wow, yeah.
That's what we're dealing with, infants especially. And it's not just the size, they're airways. They're just more delicate. Positioned a little differently, too.
So the margin for error, it's almost non-existent.
Pretty much. High risk of complications.
Yeah.
Damage to the cricoid cartilage, that's a big one. And for kids, that could be a huge problem down the line, impact their whole development.
Because that cartilage, it's still growing, right?
Exactly. So, yeah, the document's pretty clear. When possible, tracheostomy is the way to go for kids, especially when it's not an emergency. Gives them the best chance at a healthy, normal airway.
So tracheostomy, that's our other option here.
Right. And it's not just about kids. There are plenty of situations with adults where a tracheostomy makes more sense. It really comes down to weighing the risks and benefits of each approach.
Okay, so walk me through it. In an emergency, when seconds count, Why would a surgeon ever choose to do a tracheostomy, which sounds a lot more complex than a cricothyroidotomy?
Well, you got to remember, cricothyroidotomy, that's really more of a temporary fix.
Right, a stopgap, like we were saying?
Yeah, exactly. Tracheostomy, though, that's creating a direct route to the trachea, usually with a wider, more secure airway. You're going for stability long term.
So it's a trade-off, speed versus stability.
Exactly. And when you're dealing with, say, extensive facial trauma, where the anatomy might be a mess, or you know the patient's going to need ventilation for a while, well, stability becomes even more important.
Right, makes sense.
And then there are the cases where a cricothyroidotomy just isn't possible.
Yeah.
Like we talked about, maybe the anatomy's too messed up from an injury, or there's something blocking the airway higher up.
So it's about choosing the right tool for the job. And sometimes the faster tool isn't the best one.
Right. It's all about giving the patient the best chance of survival, both in the short term and the long term.
Speaking of long-term, the document also talks about complications and, well, it doesn't sound pretty.
Yeah, no sugarcoating there.
Yeah.
Anytime you're operating on the airway, there's risk involved. But that's why it's so important to understand the procedures, the risks, the benefits, so you can make the most informed decision possible.
And they break the complications down into early and late, right? Like what happens right away versus what could happen down the line.
Exactly. And some of those early complications, those can be pretty scary. Like if the tube gets misplaced, or a pneumothorax, air leaking into the chest cavity.
That sounds pretty bad.
Yeah, those are serious situations. They require immediate attention, but then you've got the late complications. Those are less common, but they can have a huge impact on a patient's life down the road.
Like tracheal stenosis, which I have to admit, I had to look that one up.
Yeah, that's a tough one. Basically, the trachea narrows, making it harder and harder to breathe. It can happen weeks, months, even years after the procedure. Imagine that.
And that can happen with both cricothyroidotomy and tracheostomy.
Yep. Anytime you're messing with the trachea, there's that risk. And then there's damage to the recurrent laryngeal nerve.
Recurrent laryngeal nerve, that's a mouthful.
It is. But it's a pretty important nerve. Controls the vocal cords.
Oh, wow. Okay. So damage to that could mean trouble speaking.
Hoarseness, difficulty speaking. Some people even lose their voice completely.
That's a pretty big deal. I mean, being able to breathe is obviously the priority. But losing your voice, that's a big part of who you are.
It is. It's a trade-off, like we were saying. And it highlights why these decisions, they're never easy. You're always weighing the risks and benefits both in the short term and the long term.
It takes a lot of courage, I imagine, for both the patient and the surgeon.
It does.
And, we've been talking about this from the perspective of an adult patient, but then there are kids, and it seems like with their anatomy, the stakes are even higher.
Oh, absolutely. Kids, especially the little ones, they're not just small adults. Their anatomy is totally different, and that makes these procedures way more complicated.
We touched on that a bit earlier, how their airways are so small and delicate, and their cricoid cartilage is still growing.
Right. And that cartilage, that's like the foundation of their airway. Any damage to that can have a huge impact on their breathing as they grow.
And that's why, for kids, the document really stresses caution when it comes to needle cricothyroidotomy.
Big time. It's not ideal. It's a last resort, really, especially for kids under 12. You got to remember, their bodies are still developing, still figuring things out. And any intervention, especially something as invasive as this, it can have unintended consequences down the line.
So it's about finding that balance, right? Delivering enough oxygen to be effective, but not so much that you cause more harm than good.
You got it. It's a tightrope walk. But that's what these medical professionals, that's what they train for. They're dealing with life and death situations, making these incredibly difficult decisions under immense pressure. It's pretty remarkable when you think about it.
It really makes you appreciate the skill, the knowledge that goes into making these kinds of decisions.
It's a whole other level.
Yeah.
We've been talking about the technical stuff, the how-tos.
Yeah.
But the human element, that's huge too.
Oh, yeah. The document touches on that a little bit, but it's easy to forget reading it that there's a person on the other end of that scalpel.
Absolutely. And those surgeons, they're not just robots. They're dealing with life and death. But they're also dealing with the patient's fear, their family's anxiety. It's a lot to carry.
It really puts things in perspective. We've been talking about these procedures, and they sound terrifying, but they're also kind of miraculous. I mean, they're literally giving someone the ability to breathe again.
It's amazing what medical science can do. And it's constantly evolving, too. New techniques, new technologies, all the time. Who knows what the future holds? Maybe one day, these emergency procedures, They'll be even safer, even more effective.
I hope so, for everyone's sake. So we've covered a lot of ground here. We talked about the different types of emergency airways, the situations where they're used, the potential complications. It's a lot to process.
It is, but it's important stuff. And even if you're never in a situation where you need to perform one of these procedures yourself, just understanding the basics, it can make a difference.
I agree. Knowledge is power, as they say. So as we wrap up, is there anything else about emergency airways, anything we haven't touched on that you think is important for people to understand?
You know, I think the biggest takeaway, the thing I always try to emphasize, is that these procedures, as intense as they are, they're all about hope. They're about giving someone a fighting chance when it seems like all hope is lost. And that's something worth remembering.
Well said. And on that note, we'll leave it there for today. Thanks for joining us for this deep dive into the world of emergency surgical airways. It's been intense, but I think we all learned a lot. Until next time, stay curious.